Good afternoon, everyone, and I'd like to welcome you to today's Wednesday Wisdom. Our Wednesday Wisdom series is a public webinar focused on delivering relevant information to support business connectivity and sustainability in our region. Each session features local business and subject matter experts and the opportunity for Q&A and for you to connect. Just a few housekeeping and updates for you. This event is being live streamed on our Facebook page, so feel free to post any questions in the comments. And we'll also have this on our YouTube page by the end of the week for you to share with anyone that you feel will find this information relevant. So without further ado, being that is Heart Month, Dr. George Ruiz, Geisinger's Chair of Cardiology, has joined us to discuss ways we can keep our hearts healthy and prevent cardiovascular disease. Community wellness is a crucial part of Geisinger's vision of making better health easy, and Dr. Ruiz will offer some tips on how we can begin that journey. Dr. Ruiz, take it away.
Thank you so much. I am so excited to be here with you today at the beginning of Heart Month, February. During February, we stop for a moment to think about the work that we do with a lot of cardiac patients. And inevitably, we also stop to connect with important members in our community to discuss ways that they can keep their heart healthy. I am George Ruiz. I am the chair of cardiology at Geisinger. And we're going to spend a little bit of time together talking about the heart, its importance, and giving you some very key strategic strategies that you can put into place starting hopefully this month that can help get you and your heart into a better and more healthy situation. The interesting thing is that I, for many years, worked on a heart transplant team. As a heart failure specialist, I care for patients whose hearts are sadly at the end of a long journey. For many of the patients that I look after, their hearts have tried for many, many years to keep them going. But in spite of many of our best efforts, the heart has continued to fail. When I've sat there and waited for heart calls for some of our patients, I've started to reflect about what things could be like if we could reverse the clock. If we could go back in time, are there things that we could do to help keep people's heart healthy? Although some of those moments are full of drama and really could be in themselves an episode on Grey's Anatomy, it's much, much better to treat heart disease from a preventive stance, to try to keep those things from getting to that extreme point. So over the next several minutes, we're going to spend some time understanding the heart and how we can keep it healthy and moving forward. And a lot of this is going to focus not so much on what we do to treat heart disease once it exists, but trying to figure out ways that we can keep it from ever happening. Let's start talking a little bit about wellness and how wellness can play into this. But wellness is a key part of trying to keep your heart healthy. And there are lots of reasons why a focus on wellness really can deliver amazing dividends to the patient, to the employer, to the system. The first is that we know that if we can keep people healthy, it helps them stay out of emergency rooms, out of the hospital, all of which can be unpleasant for patients who are there and would rather be doing other things. And also, it could be incredibly costly. We also want to focus a little bit on how we can prevent disease. And by doing that, focusing on understanding the risk factors and then trying to mitigate them, as well as identifying chronic diseases like diabetes, for example, that we know can lead to cardiovascular disease, identifying that and treating that. And the hope is that if we can do this, we can create a virtual cycle that not only keeps people healthy, but also ultimately leads to lower cost care. There are several key points that are really important to understand on this journey that we have towards better heart health. in many ways, it starts with understanding your risk factors. And we'll go through them in detail so that you understand which ones you control and which ones you don't. But understanding the risk factors really puts up the targets, both for the provider, for the doctor and or advanced practitioner, as well as for the patient. So understanding the risk factors really is that first step. The other thing that you can certainly do on this journey is making good choices when it comes to what you eat. Food is medicine. And if you choose the right food, it hopefully will lead to better health outcomes over the course of your life. Choosing healthy options can sometimes seem daunting at first, and we'll go through some ways that you can start to differentiate healthy from less healthy options. But that is a very key part of keeping your body moving forward, and in particular, your heart healthy. The third stop on the way is exercise. And this is incredibly important for you to understand. While you're sitting here watching and or working at your computer, walking around the office, your heart is pumping blood throughout your circulation. The heart is a muscle, and its job is twofold. It fills with blood and pushes blood through the circulation. When you're sitting there listening to me, your heart is pumping about 5 liters of blood flow a minute through your body. And those 5 liters are bringing oxygen-rich blood to all of the tissues of your body so that it can function and therefore you can function. So it really is no surprise that exercise is an important part of keeping that heart muscle healthy. It's amazing to think that the heart muscle, if someone is doing more and more activity, can give you more and more flow. Flow is the currency of life. Without the flow, there's no go. And so that's why keeping the heart moving is so important. Imagine an Olympic athlete going for a gold medal. Their heart could be pumping up to 10 liters of blood flow per minute. And so it's really not that crazy to think that that muscle needs to be exercised. And that's a very important part of moving towards heart health. The next one is quit smoking. Smoking is known to be incredibly detrimental to the heart arteries. Smoking injures arteries in the body. And when the arteries are injured, they become a magnet for cholesterol that floats through the bloodstream. When the cholesterol goes into these injured arteries, it creates these plaques that are basically a collection of cholesterol in the wall of the artery. And if these plaques suddenly rupture, that's what can lead to a heart attack. So it's really, really important that we manage smoking. And the last piece is to find ways to reduce stress. There are tremendous connections between the mind and the heart. And so oftentimes how you perceive things, how you feel, the stress in your external environment can increase levels of adrenaline that can be toxic to the heart. So it's really important that we find ways to manage the stress in a productive and creative way so that you can start to manage your external environment and bombard the heart less with a lot of these chemicals that can be detrimental. And we'll go through some very important ways that you can do this. So the risk factors for heart disease are many. And we're discovering more and more about these risk factors all the time. The risk factors generally fall into 2 large categories: those that you don't control and those that you do. One of the ones that we do not control is our family history. Families, as my mom would often say, are there to be loved, not to be chosen sometimes. We don't choose our families. And we often, sadly, cannot choose the history of our families and their health issues. But we can understand the family history, that's an important piece of the puzzle. So understanding the family history and bringing that to your physician or provider would be an important part. Things that I look for, particularly in family history, is evidence of heart disease that happened early on in the life of anyone in your family. The more immediate the family member, the more significant it is. So if, for example, you have a brother or sister that had a heart attack early on, let's say they were in their 40s or early 50s, that's an important clue for the providers that are caring for you. It tells them that something may be running through your family, a disorder, whether it be in terms of blood pressure or cholesterol, something may be running through your family that has increased the family's risk. So this is an important piece. And that one, sadly, you may not be able to control, but it is important to be aware of. In terms of risk factors that you control, many of them are on the screen in front of you. The first is blood pressure. Just like smoking, which can damage the arteries, high blood pressure can also lead to damage in heart arteries. Again, and once the artery is damaged, it can become a magnet for cholesterol that then builds up in that wall of the artery. High blood pressure is often called the silent killer because many people will have high levels of blood pressure and not know it. They may feel well. And it's only as a result of having that high blood pressure over time that it leads to significant impact on many organs in the body, the heart being one of them. High blood pressure can increase your risk of stroke, not only heart issues, but it can also directly impact your kidneys and severely damage them. On to cholesterol. Cholesterol is often very misunderstood. Cholesterol is an important part of each of the cells in your body. Cholesterol is one of the basic building blocks of the way the cell is structured. Interestingly, cholesterol runs through the bloodstream. And if you have high levels of cholesterol in the bloodstream, that itself can injure the inside of the heart arteries. As a result, then cholesterol will build up in the heart arteries and lead to the arteries developing these cholesterol plaques. The plaques, then the artery then tries to heal this cholesterol buildup and ultimately can lead to calcium deposition in those arteries, which can lead to what people have traditionally called hardening of the arteries. That basically refers to cholesterol buildup inside the walls. And when we see this cholesterol buildup, which we often can, sometimes on CAT scans, we can see them, we can actually characterize some of this plaque. It really pushes us as providers to aggressively lower the cholesterol levels. You should know that cholesterol can start to build up inside of these arteries even in your teenage years. And so it's no surprise that sometimes when people get to their late 40s, 50s, they may have significant cholesterol buildup already. Other conditions that we know may also impact the heart health. And among these are chronic conditions like diabetes. Diabetes leads to high levels of sugar inside the bloodstream. And those high levels of sugar themselves can damage heart arteries. High levels of sugar, diabetes, can impact blood vessels throughout the body. It can impact blood vessels in your eyes, leading to ultimately to blindness. It can impact the blood vessels in the heart, leading to an increased risk for heart attack. And also the blood vessels in the kidney, again, leading to kidney failure. So if you have diabetes, it would be incredibly important to identify it and treat it aggressively. And nowadays we have many, many medications for either hypertension, for high cholesterol, for diabetes that can effectively manage this risk factor and hopefully put it to bed. The next one, the next major risk factor is in terms of monitoring your weight. It's really important to try to maintain an ideal body weight. This can be really challenging, particularly in our high calorie environments that we find ourselves. It's understanding what your ideal weight is and moving towards it. I think it could be a very powerful way to reduce your risk. And then the last is that you make some healthy choices around the foods that you eat. And we'll go through how to identify these. But needless to say, increasing the amount of fruits and vegetables in your day-to-day diet could be a very important way to keep heart disease away and to keep your heart moving in the right direction. And I think if you implement some very basic strategies, especially around snacking, I think that people can make much better decisions. So since we're talking about eating, there are lots of things that we can start to hone in on how to make better choices. We talked briefly about fruits and vegetables, and they really are one of the cornerstones of keeping your heart healthy. Increasing the amount of food intake that is fruits and vegetables will have a significantly positive impact on your heart. So if you have a lot of colors on your plate, that is a good thing. And that's not to mean processed foods, it means fruits and vegetables. The next is when you're picking proteins, to try to pick proteins that are lean. And or if you could, I would shift away from red meats and focus more on fish. The protein in fish can be incredibly helpful for your muscles and for your overall body health, but you can deliver that protein with a lot less saturated fats. And so if you can pick proteins that are more lean, it will have an impact on your overall heart health. And if you'd like to pick plant-based proteins, such as, for example, tofu or beans, that could be a very powerful way to get the proteins that you need without the unwanted, unhealthy fats. Once you pick the food, then how you prepare it can also be incredibly important. I mean, I will be the first to admit that it's very difficult sometimes to overcome the savory taste of something that's been fried. There's no doubt about it that there is something special about it. But over the course of the last several years, I have personally been trying to take the same protein, protein that I like, and find ways to bake it instead of fry it. What ends up happening is when you fry the food, it increases the level of oxidants that the food has, and that can lead to, again, damaging the blood vessels inside of your body. And so if we find ways to prepare the food in ways that are healthier, baking might actually be a great strategy. In terms of picking foods that have healthy fats, so the fats can come in several different flavors. One of them could be unhealthy fats, and there are plenty of healthy fats as well. And some foods, for example, that have healthy fats would be avocados, for example, have a lots of healthy fats that can help you not only stay satisfied, in other words, not feel hunger, but also help you have a healthy meal. Salmon, as an example, also has a fair amount of these healthy fats. So it could be a very important part of your diet. And then in terms of low-fat dairy, I would use that in moderation. And the last is picking snacks in a wise way. So in your workplace, if you can, it would be wonderful to have a place where you could keep some apples or keep some almonds, for example. This could be an easy way to try to kill some of the cravings at the same time as you can, eat something that's healthy. I have to admit, it can be difficult. And if you came to the pantry in my house, I won't lie to you, I have 3 teenage daughters. You'd find Oreos from time to time. They are there. But we're trying more and more to substitute, instead of having the Oreos, can we eat an apple? Or can we have some almonds? To try to abate the hunger and at the same time make a healthy choice. Exercise is such an important part of keeping your heart healthy. Currently, folks are recommending that you have at least 30 minutes of exercise 5 days a week. Now, I don't know about you, but I am certain that many of you have very, very busy lives running around doing a lot of stuff to make Northeast PA a great place to live, a great place to do business. There's no doubt that your Outlook calendar is full. I myself have a pretty built-in Outlook calendar, and I will tell you, I've been working very aggressively to find that time where I can keep my heart healthy by exercising. I think throughout the course of this month, you'll see that we're going to actually reach out to folks right in our own community to find ways to make exercise possible. Northeast PA, by the way, is an amazing place to think about exercise. There are so many things that we can do. There are so many trails that we can go on. You can just walk around your neighborhood. Walking is an amazing way to keep your heart moving forward. If you find yourself really busy and don't think that you can figure out 30 dedicated minutes to doing exercise, then there are ways that you can work out in your workplace. And that's a really important part of the message as well. Where you work, if there are stairs, take the stairs instead of the elevator. If you have a few minutes between projects, then go for a walk, or even have a meeting with the people that you need to connect with while you're walking. It can be an excellent way to keep the blood flowing, keep your mind working, and then do a 2-for-1. Get the business mission moving, but at the same time, keep your heart healthy. And it's important to point out that regardless of your physical issues, we can likely find an exercise for you. So for many people who are even in a wheelchair or bound down in some way that they're limited by their joints, there are lots of ways that we can keep the heart and the body moving. So if you have significant physical limitations, I would connect with your provider and try to decipher an exercise that fits with you. So for example, we have some patients that have significant joint issues, and we often recommend that they jump in a pool and that they do the same kind of exercises in a pool because it's much less impact and actually can be much more forgiving on their joints. Finding a way to exercise as you're in your day-to-day, I think tells your body that you care about it. And it's really important to find that time. 30 minutes seems like a lot, but if you thought about how much time we waste, I think if we can get those 30 minutes in, it could make a huge impact. If there is one thing that you can do to reduce your risk of having a heart attack or disabling heart issues, the one thing that I would recommend is that you quit smoking. Smoking has been linked to so many challenges. The heart is the one that I'm focused on as a cardiologist. We know that it leads to damage in blood vessels, in the arteries, that lead to the cholesterol buildup, to the stiffening of the arteries, to heart attacks, to strokes. But interestingly, smoking also destroys the lung tissue. And this can lead to COPD, emphysema. This is a terrible condition where people's lungs just cannot do the job that they used to do. And patients often describe this feeling as living with a bag over their head. Very difficult for them to breathe. Many of them end up on oxygen. And that's not even to mention the risks that cigarettes pose with regards to lung cancer and other cancers. So if there is one thing that you would take away from today, it is find a way to quit smoking. Now, I'll be the first to tell you, it is difficult. It is a difficult undertaking. I talk to patients all the time about quitting smoking, and sometimes, in spite of their best efforts, they find it incredibly challenging to do. It's no surprise. Cigarettes have been made very addictive. And from my perspective, when I talk to patients about it, I try not to berate them or beat them up about continuing to smoke. I encourage them. I give them positive reinforcement, like, you can do this. Come on, let's move forward. And nowadays we actually have ways to cut the cravings and to make it more possible. So if you can do one thing for yourself or for someone you love who is smoking, get them to get closer every day to quitting. There are so many connections between the mind and the heart. The brain sends nerves down to the heart. They communicate consistently throughout the day. The way you know this is if you find yourself in an alarming situation, no surprise, your heart rate goes up. It's because the brain that's sensing something in your environment sends signals to your heart, and your heart responds. And this is evolutionarily traces back to the beginnings of humanity. So before we worked in corporate settings, before we were in buildings in front of computers, at one point, probably hundreds of thousands of years ago, we were out in the environment facing significant physical threats. We'd come around a corner and there's a tiger, and oh, suddenly your brain is sending your heart signals. Listen, we got to get out of here. But although the tiger may have disappeared in large parts for many of us, unless obviously if you're working in a zoo or some other place, although the tiger's disappeared, the stress has not. It's really important to recognize that this fight or flight response is still in a very integral part of being human. And that fight or flight today may not be elicited by a tiger. It may be a deadline. It may be trying to get the kids after school. It may be running between activities or getting the stuff bought at the supermarket or making dinner or any one of a million of the demands that you may find in your life. And one of the things that I have found to help me the most is mindfulness. So what is mindfulness? Mindfulness is making sure that your mind and your body are connected and in the same space at the same time. I can tell you that throughout the course of the day, it's very easy to find people whose bodies may be here, but their minds are somewhere completely different. And when your mind and body are separated, you really become more vulnerable to a lot of the day-to-day trials and tribulations. So if your mind and body are connected and you experience something that's stressful, then your mind can recognize that this is something stressful. And then you can make a response that you can think about what that response will be. Otherwise, a lot of the responses that you will have to day-to-day stress are reflexive. You are like, you hear something, it makes you angry. You're angry. Next thing you know, your heart is racing. Or you hear that a project deadline got moved up, and you're immediately reacting. Mindfulness means that your mind and body are in the same place, so that when you get a stimulus, when something gets your mind ignited, then you can stop, understand the importance of it, and then make meaningful steps towards addressing what you need to do. As opposed to reacting, it gives you the opportunity to think it through and then to come up with a thoughtful approach. And that actually helps your mind and body and your mind and your heart get in sync. And then you start to realize, well, yes, I understand that the deadline is tomorrow. I understand that this could be stressful. But instead of reacting, you can start to think, well, okay, what are the next 3 things I need to do in order to move this forward? Let me start on the first one. And that gives you the opportunity to start to control how you respond to your environment. That is an incredibly powerful tool. If you can start to not react, but to thoughtfully consider, it changes the paradigm for you, for your mind, and not the least of which, your heart. So being mindful, I think, could be a really important way to move towards heart health. The other thing that we notice is that sometimes when we're in these situations, we reach for things that keep us moving. Caffeine, for example, could be something that we load up on. Caffeine can bombard the heart, lead to all sorts of additional heartbeats, palpitations, that what we call. These are important pieces. That these are things that we're doing, and if we find ways to reduce stress, and also, by the way, I didn't mention that much, but very important, to get a reasonable night of sleep, then things like caffeine become less and less necessary. And then if we can find ways to create balance in our life, between our responsibilities and the things we love, between the things we love and the things we have to do, if we can find ways to create that balance, and that is an ongoing journey, friends. That is a journey that I am on myself. I have not yet found that perfect balance, but I can tell you that it's a worthwhile journey to get on, because the closer we get to finding that balance, the more likely we are to keep our heart in the game. And so it's really important for us to try to figure these things out. Specifically, in the workplace, it's a very important thing for us to try to figure out, like, how can we manage stress in the workplace? That's something that we're working on here at Geisinger within cardiology. And I'm sure it's something that you're working on where you work too. We've added some additional resources that will be part of the presentation for you to be able to link to additional information that can really flesh out some of the topics that we talked about today. So to summarize, the heart is a very important part of the circulatory system. Its job is to pump blood through the body. There are many risk factors that can lead to disease inside the heart arteries. We went through many of them: high blood pressure, high cholesterol, diabetes, smoking. If we do a great job at managing these risk factors, we can reduce your risk. And there are things that you can do too, such as exercising on a regular basis, finding ways to manage your strength, and mindfulness, which is a big part of that. It can really be a ninja trick to keep you focused and moving forward. Our hope is that this month, during Heart Month, that you look at these things and you pick one, maybe you pick a couple, and you move your heart in that direction. Maybe you need to think about your risk factors. Maybe you have some risk factors that you've identified and need to go see a provider so they can help you come up with a strategy to deal with them. Maybe it's that your cholesterol's been high and now we are going to try to bring it down, or your blood pressure's been high and we're going to try to get you on some medications to try to bring it back into a reasonable range. Maybe it's something as simple as just understanding your family history, or making time to start exercising, or thinking about ways to manage your stress. Whatever you choose, I want you to know that it's a great choice. If you choose something on the list that gets your heart closer to health, then that will hopefully get you closer to feeling better about your day-to-day, about what things that you're doing in your life, and keep you and your family moving forward. I appreciate you spending some time with us. And on behalf of Geisinger, thank you for listening to our message of hope and heart health. I hope that it makes the Wyoming Valley and the businesses that make it so vibrant better and stronger moving forward. Thank you.
Thank you, Dr. Ruiz. I'm just going to stop the share here for a quick second. Awesome. That was a wonderful presentation. Lots of great tips and tricks in there. You mentioned a few tricks or tips, I guess, that employers can do and business owners can do for their employees, such as swapping out some snack items for almonds, apples and bananas and oranges and such. What are some things that employers and business owners can do, though, to just help raise awareness, during this month and then throughout the year to make sure their employees are, taking that one step forward or that initial first step towards healthy heart.
I think Heart Month reminds us all that heart disease is sadly the #1 killer in the country. And I think that more and more you see how businesses are deeply engaged in keeping their people healthy. And it's not just because we're trying to be productive or driving the bottom line. I think that in companies that care for each other, they create better products. That's true at Geisinger, right? If you create an environment where people care for each other, that is a great environment to be in. And caring about each other could sometimes mean listening to each other's stories, could sometimes mean being there and supportive when some of our colleagues are going through a crisis. But for businesses, it could also mean putting out healthy snacks so that folks are like completely engaged and feel like, you know what, maybe it's time for an apple break. Interestingly, I will tell you, and this is from my own, just from my own personal, if you go and have a high fat, very dense caloric snack during the day, you will inevitably find one of your colleagues who's partaken slightly more than the usual, and they will start falling asleep at their computer shortly thereafter. If you pick the right snacks, that doesn't really happen. I can't tell you that I've ever had a packet of almonds and then been put to sleep. I can't tell you I've had several cupcakes and experienced that sleepiness, but never after almonds. So sometimes making the right choices actually sets you up to be productive. And that's where I think, in terms of the business community, you'll see that a lot of the lines are blurring. How we care for each other, those lines are blurring. So if we can invest in each other's health, I think that we can create better workplaces. Better workplaces lead to more productivity, better outcomes, more creativity, attracting better people. And that's the kind of thing that we were trying to build here at Geisinger. And I'm sure people are trying to build throughout the greater Wyoming Valley.
Thank you. Thank you. Yes, indeed. All great points there. Especially, leaning in on the holistic view of attracting more employees and just growing your business in this area in the Wyoming Valley. Thank you. Thank you. One last tip, if you'd like to give us outside of the, keeping our hearts healthy, how do you tie a bow tie? What's some easy tricks and tips on tying that bow tie of yours? Oh, we get a full demo.
So you make one loop through, you put this over to the side, and then you have to make it look like a bow tie, and you hold it between your index finger and your thumb. And then you loop this around the front, over the back where your thumb is, and this is the tricky part. There's a virtual space here. You push this one through, grab it on the other end, and pull. And that, my friend, is how you do it.
Good deal. Much easier than I thought. Awesome.
You got if you want to do it though, you got to play it back in slow motion. So
We
I
will
don't know
try.
if there's a slow motion capability on the live feed, but if you record it, just play it back in slow mo.
We will try. The good news for everyone out there, this recording will be up on our YouTube and on our Facebook page for you to go back, get some of these information, share it with your employer, with your colleagues, and then help raise awareness throughout the month of February here, and then throughout the year, taking those extra steps towards better health, better heart health overall. And then, when prompt time comes around, you can get to the end and get that bow tie technique. Thank you. I want to thank everyone for spending your lunch hour with us here for Wednesday Wisdom. Keep an eye on the chamber calendar for all upcoming events, all future Wednesday Wisdom. Should you have any ideas and topics you feel we should cover here on our Wednesday Wisdom series, please do so and send those ideas in at events at WyomingValleyChamber.org. But for then, if you want to also sign up for a newsletter, you can do so on our website at WyomingValleyChamber.org. Until then, have a great rest of your week.
Thank you.
Adios.